Hi there, I'm Dr. Jesse Morse and I am a sports medicine doctor here at the Osteopathic Center in Miami. So let's talk about a very common injury that I happen to see often and a lot of people will probably develop at some point in their lives. More common in athletes and in people who are playing sports, but regular people who are not doing any sports can also get it as well. That's called jumper's knee, or what we call patellar tendonitis. So I have my nice knee model here and I'm going to walk you through why it happens, what exactly is going on, and how to basically fix it. What do we do to make it go away for good? So this traditionally happens to this part of the tendon right here. So we have the lower leg bone here, we have the joint itself, this is the meniscus, this is the kneecap right here. And what happens is every time someone jumps, this tendon attaches to the kneecap and attaches to the bone. It pulls down. And what happens is repetitive jumping over and over again is going to cause little micro tears in this tendon, this part of the tendon, where the tendon attaches to the kneecap. So this is very uncomfortable pain underneath the kneecap, usually in the front. It doesn't have to do with trauma. It usually has to do with repetitive motions, whether it's over the course of a day or over the course of a week or several weeks over and over again. And this thing just continues to micro tear and eventually to the point where it starts to bother you. So in comparison, runner's knee is on the other half, the other top part of the knee. This is jumper's knee, this is on the bottom. So this is a frustrating and tender injury. If you push underneath your kneecap, the skin right underneath it, and that's tender, that's what we call patellar tendonitis. So the issue with the tendons in the body is that they don't have a good blood supply. Unfortunately, they don't heal very well as a result. So if you fracture a bone or if you tear a muscle, they have good blood supply, so usually they heal pretty good. But unfortunately, tendons and ligaments don't have good blood supplies. That's why you have to rebuild an ACL. That's why your Achilles tendon, once it gets beat up, it doesn't really heal on its own. So this is another tendon. And the issue with this one is that because we're constantly jumping, this thing is constantly pulling down on the kneecap, and the little fibers start to tear, kind of like pieces of a rope. It starts to fray. Now the kneecap still needs to be pulled down, because if it doesn't, the knee doesn't work. So at that point, the body's like, well, I need full strength to pull the kneecap down, but the tendon isn't strong enough to do it. So it starts to tell you that it's not happy. And what it does is it will have tenderness, usually not a lot of swelling, but it can be uncomfortable. Some people will ice it. That can be very effective. Some people will take some anti-inflammatories, ibuprofen, Aleve, something like that. While effective, usually not the best solution for a long term, because you're really just helping with the pain, but you're not correcting the underlying issue. The next step above that would be something what we call a patellar brace, which basically is a little brace you've probably seen before that goes around the back of the leg and goes around underneath the kneecap and kind of puts tension on that kneecap. It's usually a strap about this wide. It's not a big, huge brace. And usually it just provides pressure just to that. So whenever this gets pulled up, it doesn't pull on that as much because that brace is taking out some of that stress. Now, unless this tendon is partially torn or fully torn, usually surgery is not indicated, because surgery would mean that they would have to literally rebuild this tendon or put sutures in this tendon and then allow them to heal, which would be a long time. So usually with this issue, we try to do physical therapy. Sometimes physical therapy is not enough, and we talk about injections. So this is not an area where steroids are a good idea. If you put steroids in here, there's a chance you're going to make this tissue weaker, which makes it easier to tear even more, which is the opposite of what you want. You need your kneecap. Without your kneecap, your knee does not function. So you need this tendon to pull the kneecap down. So this area needs to be strong, just like this area. So when we talk about this, one of the things that you can actually do to improve the quality of this tissue decrease the inflammation, and improve the pain is a couple different types of injections. One of which is called a PRP injection, where we take out blood from the arm, we spin it down, and we get the growth factor rich layer of plasma and platelets, and you put it back in there. Now, this is a little uncomfortable, but very effective. The body essentially sends out signals saying, hey, I need to fix this. The product is in there, and the body says, oh, hey, I have the products, I can fix this. And it starts to go to work. The more advanced version of that is bone marrow. Bone marrow taking out of usually our own hip, even higher concentration of factors, and then you take the same theory, you go in and you drop that medicine right into the tendon, usually under ultrasound, because you can see exactly where it's damaged. There are a couple higher levels than that, something called amniotic tissue allograft, and then another thing called an exosome. Both of them are basically stronger versions of bone marrow. But either way, these are unfortunately really the only things that are going to help with a partially torn or tendinitis, besides your physical therapy, your ice, and your oral anti-inflammatories. That gives you an idea of exactly what's going on with jumper's knee or patellar tendinitis. Thank you for tuning in. Be sure to like the video and check out some of the other ones. Take care.